Hi, I'm Elizabeth Ray. This presentation on Williams syndrome was developed for Leanne Young's EDS 522 class on working with families at the University of Kentucky. Williams syndrome is also known as Williams-Beuren syndrome. It's a rare genetic disorder present at birth. It affects 1 in 10,000 people worldwide. Currently, there are approximately 20 to 30,000 people in the United States with Williams syndrome. It occurs equally in males and females and across cultures. Clinical diagnosis for Williams syndrome can only be confirmed by a blood test. Currently, the most popular test is known as a FISH test. It's a diagnostic test of the DNA that detects the elastin deletion on chromosome number 7. It's successful in diagnosing more than 98% of cases of Williams syndrome. There's also a new test called a microarray analysis. This test not only identifies the elastin deletion, but can also provide information on the exact size of the deleted areas on chromosome 7. Many individuals remain undiagnosed or are diagnosed at a relatively late age. This is concerning due to the possibility of significant medical problems that can occur with Williams syndrome. When the characteristics of Williams syndrome are recognized, referral to a clinical geneticist for evaluation is appropriate. In this photo, you can see the results of a FISH test. The sequence that is stained red can no longer be seen in the chromosome with the deletion on the right. Generally, Williams syndrome is characterized by a combination of cardiovascular disease, developmental delays, and learning disabilities. But people with Williams syndrome also exhibit striking verbal abilities, a highly social personality, and an affinity for music. Individuals with Williams syndrome tend to have a distinctive facial appearance. Some of the characteristics include puffiness around the eyes, a short nose with broad nasal tip, wide mouth, full cheeks, full lips, and a small chin. In addition, people with Williams syndrome tend to have a long neck, sloping shoulders, short stature, limited mobility in their joints, and curvature of the spine. Some also have a star-like pattern in the iris of their eyes. This tends to occur more commonly in children and people with blue and green eyes. There are also medical problems that can be associated with Williams syndrome. The most common is cardiovascular disease. In people with Williams syndrome, this is caused by the narrowing of the aorta and pulmonary arteries. By age 30, a majority of people with Williams syndrome have either diabetes or prediabetes. In addition, a majority also experience mild to moderate sensorineural hearing loss. It could begin as early as late childhood for some. Kidney problems and hernias are also more common in people with Williams syndrome than in the general population. Some infants with Williams syndrome may have an elevated blood calcium level called hypercalcemia in infancy. Hypercalcemia can cause extreme irritability and colic-like symptoms. The symptoms typically last between 4 and 10 months and delay the acquisition of sleeping through the night. Children with hypercalcemia may have a lifelong abnormality in their calcium and vitamin D levels and need to be monitored regularly. Most infants with Williams syndrome are born at a lower birth weight than their typically developing brothers and sisters. Slow weight gain is common, and some are diagnosed as failure to thrive. Feeding problems that are prevalent in infancy and early childhood can be linked to low muscle tone, severe gag reflex, poor suck-swallow, and tactile defensiveness. Small, widely spaced teeth are common in children with Williams syndrome, as well as a variety of abnormalities in bite, tooth shape, and appearance. These, however, are easily corrected with orthodontia. Some disabilities prevent family members from connecting with their child. However, parents and family members of individuals with Williams syndrome need not worry about this. People with Williams syndrome have an overly friendly personality. They exhibit high levels of empathy, are typically unafraid of strangers, and have the ability to see past race, culture, and socioeconomic lines. They typically prefer contact with adults more so with children because of their extraordinary social skills. This overly friendly personality, however, is countered by unusually high levels of anxiety and excessive worry. As individuals with Williams syndrome outgrow the structure of school and family activities, they may experience intense isolation, which can lead to depression. They are extremely sociable and experience the normal need to connect with others, but often lack the ability to process nuanced social cues. This makes it difficult to form long-lasting relationships. The cognitive profile of a person with Williams syndrome shows definite strengths and weaknesses. Typically, the strengths include speech, especially concrete and practical vocabulary, long-term memory skills, and social skills. Most people with Williams syndrome have weaknesses in fine motor skills, spatial relations, numbers, and abstract reasoning. Most individuals with Williams syndrome have an affinity to music. They are touched by music in ways not usually seen in the general population. It's not uncommon for those with Williams syndrome to be reduced to tears by classical music or be moved to dance and laugh by happy music. Their sense of rhythm, ability to remember lyrics, and their hearing sensitivity can help them overcome some of their weaknesses. Music therapy is often used in educational settings to help with math and other concepts. Sometimes that affinity to music progresses to excellence in music ability. Since most individuals with Williams syndrome prefer to play by ear, non-traditional lessons in guitar, piano, drums, and voice are most helpful. There is no cure or standard treatment for Williams syndrome. Treatments are based on individual symptoms. Ongoing cardiovascular monitoring for narrowing of blood vessels, high blood pressure, and heart failure is recommended. The therapies that are most commonly used to maximize the potential of individuals with Williams syndrome are physical therapy, occupational therapy, and speech. Some degree of cognitive delay is found in most people with Williams syndrome. Early intervention and individualized education plans are the key to both educational and vocational success. Most adults with Williams syndrome live with a caregiver. However, some function independently, complete academic or vocational school, and live in supervised homes or even on their own. Medical complications may shorten the lifespan of those with Williams syndrome. There are several resources for families who are affected by Williams syndrome. The first is the Williams Syndrome Association. It can be found on the web at www.williams-syndrome.org. It was formed in 1982 by and for families of individuals with Williams syndrome. It provides member support through yearly regional conferences and social gatherings, quarterly newsletters, and biennial conventions. In addition, they also provide camps throughout the United States for those with Williams syndrome. Their website also lists many suggestions for books that can help families throughout different phases of life. Since Williams syndrome is an uncommon disorder, you might be feeling like there is no one to connect with about issues related to your child or family member. The MUMS National Parent-to-Parent Network, found on the web at www.netnet.net/mums, can help. This website matches parents with other families around the country who are experiencing the same disorder. This could be extremely helpful if there aren't other families affected by Williams syndrome who live near you. The Canadian Association for Williams Syndrome, found on the web at www.caws-can.org, can give you information as well as specific interventions and resources found in Canada. I hope this presentation provided you with the information you were looking for. In addition to the websites I just told you about, the 3 listed on the following slide were used to prepare this video.